Medics in Kenya are working to raise awareness about childhood cancer, including the signs and symptoms to watch out for and the need for early diagnosis and treatment. Experts say most childhood cancers can be cured. This means many of the deaths among children with cancer in low and middle income countries can be avoided if the disease is diagnosed early. CGTN's Wilkister Nyabwa spent a day with a parent and her child in Kenya's biggest referral hospital and filed the following report.
This is the entrance to the Children's Cancer Ward, one of 3 such wards at Kenyatta National Hospital, Kenya's largest referral facility. Parents who are referred here with their children hope that the medics will treat their children and send them home with a clean bill of health. But it's not an easy journey. Flivia Naviole tries to create a sense of normalcy for her daughter, but her efforts to be jovial cannot mask reality. The two have spent the better part of 2020 admitted in this ward as her daughter battles leukemia, cancer of the blood.
It started when I noticed that she was tired all the time, which was unusual.
The test results confirmed their fears, and they began the journey of cycles of costly treatment, stays at the hospital, and desperately clinging to hope.
I would love to be told that my child is cured, but they say the ultimate treatment is a transplant. I wonder how I would afford that as chemotherapy is already expensive. We just keep hoping and praying for a different outcome.
Flivia's daughter is one of 71 cancer patients in the ward. The most complex cases from across the country are sent here. Some are accompanied by parents, while older ones have some independence, and doctors say the numbers are rising.
Numbers are increasing, and we could say for us as Kenyatta National Hospital, we are probably handling the bulk.
Dr. Irene Zamo is a pediatric hematologist and oncologist, meaning she treats children with cancer and blood diseases. Leukemia is the most common type of cancer among the young patients at this hospital, followed by lymphomas, cancers that start in the body's lymphatic system. When it comes to solid tumors, kidney tumors are the most common at the hospital. Liver cancer and cancers of the muscle are also common. Most patients range in age from between 2 to 8 years old.
Most of the cancers in children are actually genetic. There will be something that went wrong in the chromosome of the baby at some point before birth, or even as they develop. We call them mutations, and that error makes them at a higher risk of getting cancer.
Data from the Kenya Cancer Network indicates there are about 40,000 new cases of cancer each year in the country, and this leads to about 28,000 deaths annually. Information about cancer in children is harder to find. Treatment can run into tens of thousands of dollars. The Kenyan government has now stepped up its response to the mounting threat of cancer. Efforts are underway to boost the capacity of health providers and the public through training on early cancer screening while expanding the availability of specialized personnel.
Anything unusual, early warning signs in a baby, that is a trigger for us to suspect, scan, do some tests, detect it early, treat early and cure. So early detection, chances of cure 85%, 90%, depending on the type of the cancer, because we have some types that are very aggressive.
For parents of children with cancer, every new finding, every new procedure, and every drug is a dose of much needed hope as they battle childhood cancer. Wilkister, Nyabwa, CGTN.